Time now 5:13. Let's get to our ABC 15 exclusive. She came back to her homeland to serve, always wanting to give back to the people who gave her so much. This morning, we're introducing you to the Navajo Nation doctor who never realized she would become a silent hero in the fight to win against this pandemic. A red cloth waving in the northern Arizona breeze, an ancient symbol for a modern-day war. And in the fight against the coronavirus, Dr. Naomi Young is one of the Navajo Nation's fiercest soldiers.
Ever since I was young, I've always wanted to be a doctor.
It's a calling so strong, it brought Dr. Young back to the Navajo Nation and her hometown, Fort Defiance.
The advantage of coming from the reservation and returning to the reservation, I think, is a big one because I'm familiar with the socioeconomic disparities that are within the community.
Those challenges include limited access to running water, electricity, and healthy food. The Navajo Nation only has a dozen grocery stores to serve an area the size of West Virginia.
Some communities have to drive even 30, 40, 50 miles just for a grocery store.
And another factor, once seen as an advantage, now credited with claiming more lives. Extended family living together in one house.
A part of our Navajo culture and the strength of our culture is the family unit. And we find that in non-COVID times, this was our strength, but it's actually one of our weaknesses that we're starting to see.
All of those factors driving up the coronavirus case numbers. Dr. Young treating dozens of patients since this pandemic began. The marks on her face still visible from the hours and hours she spent wearing a mask. She says it's a small inconvenience and no match for the suffering she's already seen far too many times.
Losing a patient to COVID is one of the hardest things that we can take as a physician, and it's even harder without the family there because in a way you have to step up as the local family member. It's that much more pressure that is kind of put on us.
And it's not just the pressure here on the Navajo Nation. When cases spiked in the valley last month, it also meant trouble for the reservation. Could that derail you?
Yes, it can, and it is a bit of concern, but we track this multiple times a day.
Dr. Loretta Christensen is the Chief Medical Officer for the Department of Indian Health Services Navajo office. Hospitals across Arizona and New Mexico have accepted Navajo patients, but
So if Phoenix and Albuquerque have no bed capacity, we can't send patients out. We've trained our clinicians, we've gotten ventilators, we have plans to expand our ICUs internally to 3 times their normal size. And we're prepared to do that.
Here at Tehutso Medical Center in Fort Defiance, they're doing temperature screenings and asking a series of questions to patients before they're allowed inside, just to make sure no one has been exposed to the coronavirus. Dr. Young says it's really been a team effort to get a handle on this pandemic here. The numbers are stabilizing, but she says they're still not where they need to be.
We all know it's not over. We all know that this is an endurance game that we're playing.
Definitely a full circle moment for Dr. Young and her colleagues. Well, tomorrow on ABC 15 Mornings, we're taking a closer look at some of those infrastructure issues we mentioned, like limited access to running water, and how that has made it all the more difficult for leaders on the Navajo Nation to get this pandemic under control.